team for something that is not really seen in communities across the United States. Actually, Chris Collado is here with us today. Thank you for joining us with the state public health. He even told me 397 local communities have this type of accreditation. You guys, that's not a lot. And why is that important to Brown County? Because we are the third largest city of Green Bay. We're the fourth largest county in the state of Wisconsin, and we should be at this type of accreditation because, one, it verifies that you are providing a level of service to your residents of your community. And so this didn't happen in a vacuum. This happened because we have dedicated employees, team members who really truly believed in Anna Nick, who you're going to hear from, our public health officer, about what this actually means and what does it require of us as a public health to actually maintain that accreditation. So it's not just going out, doing a couple things and then getting your reward and saying you're accredited. You actually have to do things for the community that ultimately benefit the public health of the community. And so we all know, with our team standing here today, that happens because we have a dedicated staff who want to make sure that we're able to provide those services at a level that we would all as a community want. I'm pleased to have here the chair of our Brown County Public Health Board, Richard Shadwell, who's going to say a few words, and of course long-term county board supervisor. And we also have a recently new elected county board supervisor, Katie McDonald, who is on the Health and Human Services Committee, who we'll hear a little bit from Eric regarding what it means from the Health and Human Services perspective. So I'm just here really to say congratulations to the team, Anna, for kicking this off and making this a priority for Brown County Public Health. We've been around for a long time, you guys, and we just now got the accreditation. It doesn't happen because someone just snaps their fingers or puts some cash under the table. It happens because we have a dedicated team, a board of oversight, direction of the leader, Anna Nick, and the team as a whole. So congratulations to the team, and we certainly look forward to what this holds into the future. And now with that, I'm going to turn it over to our Director of Health and Human Services, Eric Pritzel, to say a little bit more regarding what this accreditation means. Eric? Yes.
Yeah, you can clap for the county executive, absolutely. So I'm Eric Pritzel. I'm the Director of Health and Human Services for Brown County, and I just wanted to say a few things today about the accreditation process and what it means, why we went into this process. The Public Health Accreditation Board is the nonprofit organization that administers the voluntary national accreditation program for tribal, state, local, and territorial health departments. So this means that Brown County Public Health chose to do this. They entered into this whole process, which started, I was looking at this over 6 years ago. We started this process, and we're talking about the journey to go to accreditation that has a big goal at the end, which few actually achieve. As the executive said, there aren't many in the country. There's only 22 public health agencies in the state that actually have met the accreditation status. That includes tribal as well as state as well as local jurisdictions. So it's a very small group that has actually met that high standard. When you look at it, and actually seeing the team up here reminds me of this, kind of why would you do this? And one of the reasons is it can be very unifying for a department or for an agency. It takes all positions, all program areas, everybody working together to actually meet these standards. It is very challenging, and it requires that collaboration and coordination across the whole public health division. We knew when the goal was completed, public health would have met the highest standards possible. If only 22 have done it in the state, that tells you it's not easy. And this sets the tone that if you're going to do things, you have to do them to the highest level possible, which is important when we look at the department and how we provide services to the public. This can help us build on the trust that's established with community partners by having them know that Brown County is taking quality improvement and performance management related to public health seriously. What this means for our stakeholders is that our community partners can know that we wanted them to have confidence that your local public health agency has met the highest standards possible. And it's not just about compliance, it's about exceeding compliance. The state does reviews periodically as well. This accreditation goes beyond what that state required review does and actually gives you a higher level of confidence. To receive accreditation, Brown County Public Health underwent a rigorous, multifaceted, peer-reviewed assessment to ensure it meets or exceeds a set of quality standards and measures. The program is supported by public health leaders and practitioners from national, state, and local levels. This is a peer review process. By continuing to improve the quality of the services, health departments can be sure they are meeting the needs of the community as effectively as possible and delivering the best possible service for the amount of money that we do receive from the public, as well as engaging with all those community partners to develop those services as well. I'm going to turn this over to Anna Nick now, our Public Health Officer, who can provide the details on the accreditation process and give some specific examples here in Brown County of how this process went. Anna.
Great, thank you. So for all that caught Troy before, Troy, I actually have 2 pages. I'll try to keep it brief, but so you heard a lot about what it is, but when I first started in this role back in 2016, it was apparent that Brown County Public Health was not where we needed to be in terms of providing services that were aligned with the direction public health was taking at a national level. And it was not operating as effectively and efficiently as it could be. At the time, we were hearing about the benefits of other health departments that were getting accredited, while also hearing from the state of Wisconsin that they added accreditation into their goal in a statewide plan. They did this understanding that accreditation promotes consistency across the country by health departments meeting national standards. As more health departments become accredited, people can expect to receive the same quality, foundational public health services wherever they go in Wisconsin or in the United States. Therefore, to be intentional in turning things around, Brown County Public Health added modernization through accreditation to the 2018-2022 strategic plan. Before I begin with what we've done here, I want to share something that I've heard, and it goes something like this. It's important as leaders to build a strong enough team so that you don't know who the leaders are, because everyone is taking a leadership role in some way or another. That is a philosophy that I believe deeply, and it's because of the Brown County Public Health team members, many of whom are here and in the audience, that we were able to meet the goal of becoming a nationally accredited public health agency, because they are both a strong team and they are leaders in the community. Kit Lavina, for example, where's Kit? Over there, has acted as our accreditation coordinator and project manager and kept us in line. She helped us twice, once when we had to move away from our FAB goal due to having a response to the COVID-19 pandemic, and again when FAB updated the measures to a new version, making Brown County Public Health, from what we understand, one of the first, if not the first, to become FAB accredited under the 2002 version. At the same time, each and every team member stepped up and helped us by looking closely at our services to determine if there was room for improvement and if we were truly making the biggest impact that we could with what we were doing and with what funding we had. Understanding that governmental public health as a field continues to be significantly underfunded when considering all the state mandates we are asked to carry out. Public health departments provide primary and expert leadership in protecting and promoting the health of people in communities across the country. They offer critical services like vaccinations, food, inspections, health testing, and screening, and much more. The team reviewed many policies and procedures to ensure that equitable health provisions was in place for the services we provide. They put together key plans, such as our quality improvement and performance measurement plans, and our public health emergency and continuity of operations plans. Most notably, we wanted to make sure we were being intentional about moving away from providing direct services to only a few people to building systems where we could impact all that live, work, and play in Brown County who truly needed our services. While there are so many examples of how this team significantly improved service delivery in both an effective and efficient way, leading to a larger impact on the community, there are 2 examples in particular I want to share. Most are familiar with our License Establishment Inspection Program, whose main goal is to inspect every establishment that serves food or drinks that that serves food or drinks to ensure that the food and drinks consumed in Brown County are safe from communicable or infectious diseases. Before we began our accreditation journey, we were not able to inspect 100% of our routine inspections. After reviewing our process and developing a streamlined approach to inspections based on quality improvement and performance management efforts, the team is now able to complete 100% of the routine inspections in addition to all the other inspections the team does. What does this mean for you? It means that you can go out to eat at a restaurant in Brown County and know that the Brown County Public Health team has inspected it and worked with establishments to fix critical violations that could have otherwise led to foodborne or waterborne outbreaks or illness in the community. Another example has been the work of Jennifer Dixon. I didn't tell her I was doing this. In the Hearing and Vision program. At one point in time, Brown County Public Health sent out at least 7 to 9 full-time team members during the school year to physically screen every student who required a hearing and vision screening. And then it was up to the parents to get follow-up care. Jennifer drastically improved this model by building up a hearing and vision system where she worked with local university and higher education systems in Brown County to carry out the screenings. They benefit because their students get clinical hours. We benefit because we are no longer sending out every one of our team members to do these screenings. In addition, she has built up the system and continues to build it up so that students who need it now also receive follow-up care, as well as are getting connected to glasses due to partners in the community. So it's just another example of how quality improvement can really affect or impact a local health agency when they start to look at their services. Since those team members who are no longer needed to do a vision and hearing screening, we were able to evaluate those positions and look at how other services are being done, and cross-train team members to support other areas, allowing nursing and environmental health team members more capacity to focus on their mandated and contracted services, resulting in better processes for following up on foodborne or waterborne illness outbreak investigations, having a more effective response for rabies cases, and the list goes on. But please know, this is not an exhaustive list, but we take service provision seriously as we work toward our mission to protect and promote equitable health and wellness through prevention, education, leadership, and partnerships. So thank you for joining us here today. I appreciate the support of County Executive Troy Streckenbach and Health and Human Services Executive Director Eric Pritzel for supporting the vision to become an accredited public health department back when I first started, and we knew something had to change, and for allowing us to take this journey to drastically improve the services we provide. I'm also thankful to our Board of Health members. Supervisor Shadowald is here, and our Human Services Committee, Supervisor McDonald is here, as well as the Brown County Board of Supervisors who have also supported this direction. Also here today are our State of Wisconsin Office of Policy and Practice Alignment team members, Chris and Janet, who have helped us significantly through this process. Lastly, thank you to the team who's here, because we would not have done this without you. Thank you.
Well, I'm Rick Shadowald, SCHADEWALD. I know how to do press conferences too. I am the Board of Health Chairman for Brown County, but not even anybody else in this room probably knows, I voted to create the Public Health Department back in the 1980s when we consolidated all the local municipalities, except for De Pere, who chose to go on their own, to create a county-wide public health department. And the goal from the very beginning was to be Titletown. And I would like Eric Pritzel to come up, and I'd like any other Board of Health members to come up, just like in the WBAY. Come here, folks. Come on up. Come on up. Come here. Come on. Let's get this trophy. Come on.
If they chose to stay back.
They can stay back there if they want. Go ahead. Patty, come here. She's one of my former students. Yes. Here. You guys can hold this. And Anna. Where's Anna? You hold this. Okay. Okay, slide in. Look at the cameras. And here's the thing I want you to know. This was always the goal, to be the best. And again, we are Titletown, Brown County, nationally accredited public health department. And I congratulate all of them. I congratulate them on their efforts to do this. I am proud to be a part of it as the Board of Health Chairman. But most of all, to the citizens of Brown County, you have some champions working for you in public health.
All right, I love it. Well done. And that,
They want one-on-one, so I don't know. Does anyone want a one-on-one with the executive?
you don't need me, right? Nobody needs me?
We don't need you.